Rehabilitating the athlete, not just the injury. The psychology of sports injury rehabilitation. It'll be presented today by Adam Gledhill and Dale Fosdyke. I'd like to tell you a little bit about them. Adam is a practicing sports scientist and Dale is a practicing sports therapist. So together, they're eminently placed to present a webinar on today's subject, being two sides of the same coin, so to speak. So without further ado, I'd now like to hand you over to today's presenters, Adam Gledhill and Dale Fosdyke.
Okay, so thank you to BASES and to Human Kinetics for inviting us to present this afternoon. The plan for today really is to try to adopt an integrated approach to achieving the different aims that you've got on the screen there. What we're going to look at doing, hopefully, is being able to blend kind of theoretical, empirical to achieving the different aims. And one of the things that's going to be quite helpful today is that we've got some of the athletes that we work with have been kind enough to allow us to share their experiences. So some of the direct quotes through the slides today are actually from these athletes. So that will allow us to provide quite a unique experience through the presentation today. So if we start looking at the scope of today, really what we see injury as is really can be encapsulated in the 5 R's, and it starts with the risk of injury, responses to injury, rehabilitation, return to competition, and retirement from injury. Now, the focus of today is going to focus on the 3 areas really that are inside that circle. So we're looking at the responses to injury, rehabilitation, and return to competition. Although we appreciate factors such as risk of injury and the transitional nature of retirement from injury are important elements in understanding the holistic injury experience, what we're really trying to do is focus down on those 3 areas from our applied experiences and try to help provide some suggestions related to how to work with athletes in these different areas.
I think what we just want to try to do is create a real strong rationale around this topic area. And I think I'd just like to start off with just recognising that within elite sport, with any level of sport, injuries are not uncommon. The statistic there suggests that annually there are 29 million incidents of sports injuries each year. And out of these 29 million, a good proportion, thought to be around 9 million, are new and severe injuries, and that this rate of severe injuries is increasing by 14%. If you look at, for example, the UEFA Club Survey as well, injuries unfortunately have stagnated across 10 years of that particular study. Now, depending on what definition of sports injury that you use, this 29 million could be much, much more. So, for example, the 29 million rate suggests those people who have actually had to sought emergency care, whereas in fact most injuries, people will not have to go to accident and emergency departments. The second one really is just to highlight that when somebody is injured, it has huge physical and psychosocial impacts. Over half of athletes, when they're injured, simply don't return to their level or their previous level of sporting activity, with even less returning to competition. This is a statistic that was first suggested by Adam in 2012 and recently updated in 2014 to actually be much more negative in terms of returning to competition. And what you need to think about is this poor levels of return to competition. Granted, it is within ACL rehabilitation, but this poor return to competition is at a time where medical technology, approaches to medicine are probably at their most refined and at their most effective, which kind of really starts pointing to the fact is there something else going on than physical factors? And could we attribute some of these non-return to competition down to some more psychosocial reasons? There is a commonplace assumption that when we decide an athlete is ready to return is when we base it on physical-based parameters, physical-based outcome measures. And this assumption is that physical and psychological recovery occur within the same time frame. And quite often they may not coincide. And with regards to that, we may be letting players back into training, back into competition when physically they are capable to do so, but psychologically not. And likewise, vice versa could certainly happen, that an athlete could be psychologically ready to return, but physically not. And I think we need to look at addressing those. An interesting fourth point on there is very much aimed at sports injury rehabilitation practitioners, and I'll come back in a few seconds to what I actually see that within contemporary elite sport. But in the work by Heaney and Alexanders, these sports injury rehabilitation practitioners do recognise that the psychosocial responses to sports injury are prevalent. They influence the rehabilitations, and present a real challenge. However, it's also a challenge that certainly these practitioners feel ill-equipped and underprepared to do based on their training, based on CPD. Now, when I try to come back to what I understand or what I mean when I say sports injury rehabilitation practitioners, certainly most people will probably be thinking about your head physios or your sports therapists, your athletic trainers or your sport rehabbers, but actually contemporary sports medicine and elite sport involves a number of different individuals. So by those individuals, I'm inclusive of that your club doctors, your sports scientists, who may well be taking up roles within clubs as rehabilitation scientists and forming their decisions on things like Prozone, and also strength and conditioning coaches, who may well be taking athletes into return to competition within that late stage of rehabilitation.
So as Dale's just alluded to, the athlete responses to injury, they're quite a complex situation for sports injury rehabilitation practitioners to be dealing with as part of their day-to-day life. And what we tend to find is that the psychosocial challenges of injury often are as, if not more difficult than some of the physical challenges. And what we've got here are a number of screenshots from different kind of high-profile athletes and people surrounding the athletes, either in their immediate social circle or their wider social circle, that discuss and highlight some of these different psychosocial challenges. But equally so, what we've got here are some examples where actually people have responded quite positively to their injury. And one of the key messages that we're going to try and get through today is actually injury isn't solely a negative experience, although on the face of it, that's something that quite often it is considered to be. So, for example, if we look at the Theo Walcott piece there from the Mail Online, it discusses a number of different things that actually he sees as quite positive elements of his injury, being able to spend more time with family and that type of thing. And you've got other examples there of athletes, if we look at some of the Derek Rose examples, where he's talking about feeling quite good in the physical sense and alluding to being back in training and that type of thing, but actually accepting the fact that something doesn't feel quite right. And that's really an important thing for athletes to admit, but also it's quite a difficult thing for athletes to admit. And particularly if we look at some of the reaction to this Derek Rose injury that was in the public media, where you've got some of his contemporaries, some athletes competing against him, talking about it, lose respect if people acted like him, and actually said, okay, physically I'm okay to train, but I'm not right to play yet. There's something that's not quite there. And when you've got people referring to athletes as selfish and that type of thing, it can become quite a difficult situation for athletes to manage. And I think then we're presented with quite a unique challenge. And we've got other examples there from people who are at the very, very top of the game. Michael Jordan referring to, his body was able to cope with being injured, but actually it was his mind that really struggled with it. And Michael Owen there at 33, when he sort of wrote this piece, referring back to an injury when he was 19 years old and the lasting impacts of that. And athletes such as Sophie Bradley there, who were talking about actually, this is an injury, it's taking longer than we planned, but we're improving every day, and there's a little bit there of uncertainty reduction that's quite important for athletes. So one of the interesting challenges really when you're working with injured athletes is trying to find a way of fostering quite a positive response to an injury. And one of the things that we're going to do today is try and provide some examples of the ways that we've achieved that through professional practice.
Before I go through maybe some of the content and the real strong impact of this particular slide, I'll just tell you a bit about its background really. This is actually some data that I saw blogged by an athlete I was working with to try to get her to emotionally disclose where she was in terms of her rehabilitation. Certainly when working with her on a day-to-day basis, I could see that actually physically she seemed to be coping quite well. However, I wanted to really kind of see where psychologically she was at. So she produced this image and this particular quote. Now, subsequently, an image very similar to this has appeared on the British Journal of Sports Medicine and really highlights the need about managing athlete expectations when they are injured. Certainly, when an athlete is injured, what will happen is they will probably turn up to practitioners expecting their experience of sports injury to be quite linear. And they expect that they're going to go from A, which is where they are, to B, which is return to competition, and just make progress. And that's all they expect. Unfortunately, what statistics would suggest is it's certainly not uncommon for athletes to have elongated or complex rehabilitation with multiple setbacks, with multiple relapses. And actually, the reality is with rehabilitation, it's a little bit more undulating, certainly changing in magnitude and direction as we go through it. So this kind of raises some really strong points here. I mean, this as itself, in terms of athletes expecting a linear experience and the divergence between what is reality, is something that I think injury practitioners should seek to address. It certainly presents a challenge for medical and support staff, particularly those that are paid full-time within elite sport. It certainly represents a challenge to coaching staff, who again would expect a linear-based experience, family and friends, and most of all, the athlete. I mean, two things that for me really hits me with the impact of this is that as athlete, when you're working with an athlete, you should never expect them to have a very linear experience. You should always prepare them to the reality, which is that it is likely they may have some setbacks. It may be that they have slow progress or much slower progress than they certainly expected. Don't try to make them think that they're going to go from A to B in a linear, quick fashion. You're just lining them up to fail. It also means that there's an opportunity here for us to plan for setbacks and relapses before they actually happen. Asking the questions, what if? What would you do if with your athletes? May help them when some of these setbacks, slow progress, relapses do occur. The quote underneath that, the worst roller coaster of my life, was actually one of the titles of the blogs this particular athlete gave me. But actually, it's not a unique, I mean, it sounds a bit of a cliche in itself, but that's because a lot of athletes will describe their experience of sports injury as being a roller coaster. It is turbulent, and I think as sports injury practitioners, us recognizing that and also getting others to be aware of that, the athlete, the parent, the support staff, the coach, is a really, really important point at that point where you're first working with an injured athlete. I am currently collecting some data for research purposes, but also with an applied work on Twitter. I'm very interested in how we can use the social media, in this case Twitter, to help our injured athletes, to provide an extra layer of social support with athletes. And these is some excerpts of some data that I've been collected since the 6th of October 2014 to present. I'm not going to present all of it. I'm only going to present the real strong quotes with hopefully some inference that you can take away yourselves. There are a number of these different Twitter handles. For example, I've just given an example of ACL Diaries here. This is almost like a self-help group for likewise athletes who have undergone ACL injury requiring surgical reconstruction. It allows that person to have a 24/7 support network. It's kind of anonymized. They get a worldwide perspective of things, so they're less likely to be isolated and a little bit insular with it. Now, I was fascinated by this question that kind of popped up with the Twitter handle ACL Diaries. If you had to choose between suffering the physical and mental pain of tearing your ACL, what would you choose? Now, the reason I've kept the "you" as it is because it's raw data in itself. And this is what came up. The first quote for me was somebody responding pretty immediately, going, "I'd rather continue to suffer physical because mentally it takes so much out of you." This is an athlete who's talking about actually the mental side of being injured. It's draining. It's taken a lot out of me. And I thought that was so fascinating. A little bit more in terms of rich detail comes underneath that with physical. I'd rather suffer physically 100%. Because it's the loss of identity reduction. So this individual's highlighting actually her identity has had to change based on being injured. It's been reduced. And the social aspect of training, that has been the hardest for me. So two key points that I've raised just with this really strong and rich quote that's kind of come out there. The next one down, the idea that actually the physical outcome measures of rehabilitation are easier to gain, are easier to maintain, are easier to restore than the confidence when it comes to ACL recovery. Just going down the list, we've got this idea that the mental pain never really goes away, and really what that suggests is, when does an athlete start to perceive themselves as being non-injured? Does that ever really go away? Does an athlete ever start to think, I've had a severe injury, I am no longer injury prone, I am no longer an injured athlete? Certainly my applied experience will say that actually that maybe doesn't happen even in a few years post severe injury like this. And then the last one at the end really kind of brings home about injuries mean different things to different people. And actually, as a girl recovering from ACL surgery, my worst nightmare is wearing heels. And this idea that actually, when you are injured, it just doesn't impact your athletic identity. It can start filtering into other domains. And that's quite important for us to acknowledge.
Okay, so one of the things that we wanted to try and get across there was just a brief introduction to some of the conceptual and some of the theoretical approaches that are used in this area. Now, in comparison to other areas of sports psychology, this is an area that's in its relative infancy. It's been around, started to gain more prominence in the past 30 to 40 years, and what we found was actually at the start of our understanding of the psychology of sports injury, there were non-domain specific models that were applied within this context to try to help us to understand injury experiences as a whole. So if we say the grief response model, for example, this is probably the most common example of a stage approach which was used to try to understand injury rehabilitation and responses to injury. And it suggests that, or one of the assumptions of the theory is that really, as the athletes will experience a sense of loss from their injury, and it suggests that everybody will progress sequentially through 5 stages of grief, being denial, bargaining, anger, depression, and acceptance. Now, whilst there's some examples of support for this particular model, particularly the stages within the model, within the sport context, actually it's been critiqued in terms of it doesn't particularly account for individual differences in athletes, and there are some difficulties with recognizing some of these different stages within a sporting context as well. And if we progress that all the way through to the cognitive appraisal model, it suggests that the way in which an athlete responds to an injury really is dictated by their appraisal of the injury, and this appraisal is believed to be affected by both personal and situational factors, and this can then help us to understand why different athletes might appraise a particular injury in different ways, and this cognitive appraisal will impact on our emotional response to the injury. So, it might start impacting on areas such as anger, for example, and then it will, which in turn will have an impact on our behavioural responses, so things like our rehabilitation adherence. And the biopsychosocial modelling there is one of the approaches that actually over time has started to gain more prominence, and it forwards the notion that the integration of biological, psychological and social or contextual factors is a key element in understanding injury experiences. Now, these approaches, although non-domain specific, have actually started to form the foundation of more domain-specific understanding, which emerged through kind of the late 90s into the early 2000s, and more domain-specific models have been developed, so they've become more commonplace, but also have been kind of critiqued in the literature from time to time for being more conceptual models as opposed to being testable theories. Now, in terms of our use of this, we're going to talk about some of these models a little bit more in more detail later on. But one of the things that's interesting from this perspective is that over the past 5 to 10 years, the body of research as a whole, and to an extent applied practitioners as well, have started to revert back to non-domain specific theories now, and started looking at how these can play a role in how our understanding of injury experiences, our understanding of rehabilitation behaviours, and it has started to help us to understand both from a research and from an applied perspective why athletes may behave in certain ways whilst they're injured. Now, the one that we've mentioned there is a self-determination theory, mainly because that's one that's kind of gained a relative supremacy or a relative presence within the literature, and has been quite useful for helping us to understand the different ways that athletes behave in rehabilitation settings.
Okay, so if I'm discussing responses to sports injury and the sort of responses that an athlete may well present with, we can put them into kind of 3 broad categories: cognitive responses, emotional responses, and behavioural responses. Cognitive responses all refer to the athlete's particular thought processes, their perceptions, and their appraisals. Emotional responses relate to the athlete's mood, feelings, and affective states, whilst behavioural responses basically relate to the person's actions, whether they don't have to be just physical actions, they can be intended actions, and more kind of psychological actions. What I've kind of put all around there is just some examples for yourself to have a look at. What we need to start having to think, though, is there is a clear response continuum. Not every athlete will exhibit the same responses. There is a response continuum ranging from responses that are mild, responses that are moderate, and responses that actually are quite severe. And for example, some of the responses that an athlete may exhibit that would be on the severe side would be things like suicidal ideations. And the severe kind of continuum end should be one that practitioners should feel empowered to recognise it and know exactly how to refer that individual on to the appropriate healthcare professional. We can also look at these responses and see actually not all of these are negative. So maybe with some of these responses we should start looking at responses that are adaptive and responses that are maladaptive. Obviously, adaptive responses would enable or facilitate a successful rehabilitation. So, for example, me having a high level of motivation may well keep me adhering to my rehabilitation program. Guilt is often thought as a positive motivator. On the other side, some of these responses could be maladaptive and actually hinder or create a barrier to me having a successful rehabilitation. So the idea of malingering, being over-motivated, may well be maladaptive responses. In terms of the Weiss Bjornsson and colleagues model, cognitions, emotions and behaviours are involved in a cycle, a dynamic cycle. And this is called, and part of the model is its dynamic core. Certainly the dominant pathway between this is that an athlete's cognitions will affect their emotions, will affect their behaviours, and subsequently behaviours then feeding back into their cognitions. Now, that's the dominant pathway. However, it is thought that there are bidirectional pathways, so cognitions can directly affect behaviours and vice versa. In terms of the Weiss Bjornsson model, what we need to think about is this dynamic core should be also seen as a 3D spiral. So the cycles that you can see going around there would come out towards you in a 3D spiral for a more positive rehabilitation or successful rehabilitation, and likewise would move away from you and invert upon itself for an unsuccessful rehabilitation or negative rehabilitation. I think what we need to think about this model is, although it's dominant within the literature, where an athlete actually exits this particular model is unclear. And it also has the assumption that psychological rehabilitation is actually happening or occurring independent of the physical-based rehabilitation. And certainly that's one of the limitations. I think something that we need to recognise with all of these responses, that the responses to sports injury have high inter and intra-individual differences. And these responses are dynamic, and the responses change in intensity, often on a day-to-day, hour-to-hour basis. They change in magnitude and they change in direction. And that's the challenge when working with an athlete that's injured presents, and it is a unique challenge. This is an example of some of the applied work that myself and Adam Gledhill have undertaken, and this is some of the sort of the applied work we've done at this early stage when an athlete has been injured. Now, this isn't an exhaustive list. There are many other strategies. Yourselves may be putting strategies in place that are just as effective. What I would say is all the applied examples that we give throughout this particular presentation is grounded in empirical and or theoretical research. So the first point of call is we really want to know what's going on with each athlete. We can see the physical stuff, we can test the physical stuff, we've got criteria for the physical outcome measures. What we've used before is the use of semi-structured or unstructured interviews to monitor the response to injury. We want to know what's going on. We want to know how that athlete's reacting, how are they responding, both in training, both out of training, is it hitting other domains of their lives? And what we would want to do is we want to conduct that interview and maybe gain some more objective measures in terms of being able to measure their emotional response, their psychological response, which hopefully we can repeat on a regular basis, 2 weekly, to see how that person is responding throughout that rehabilitation stage within that rehabilitation process. What I would warn people is that it is beneficial when working with elite athletes to use more than one inventory. Most of these inventories are based on a single construct, and actually using multiple inventories may help triangulate your responses. Using the inventories with your interview data may give you a better picture of where your athlete is. From my point of view as an injury practitioner, I've also got to sit back and think, do you know what? An athlete may well be having questionable emotional integrity. And by that I mean, because I'm the sports injury practitioner, am I getting the data, the trustworthy, rich data that I want to get on that particular athlete? And often triangulating the more subjective interview data with some more inventory-based measures might get me a little bit more accuracy there. The second point there is something I've used quite a bit, which is encourage athletes to submit blogs. I recognise that athletes' integrity may be questionable, and have explored them actually, rather than telling me face to face, I've explored them using different other media to tell me what's going on. Media that they might see as safer, or might even be a little bit better for those athletes that struggle to communicate face to face. So I've used blogs, and I've also used blogs with images to really try to understand their experience and understand how I can better manage that athlete. What are the cues that I need to be aware of? How can I work with them? I want to know that. And that forms an important emotional disclosure for me. The third one down is part of what I want to do with that early stage is create a reflective expert patient. Now, what I want to do with that is I want to get that individual to learn about that injury. I want them to encourage them to see their injury as a positive experience, one that they can learn more about their body, more that they can start exploring other things that they can do whilst they're injured. They can learn more about their position. They can learn about the anatomy of that area. I'm thinking of an example where I worked with a 12-year-old female, and I asked her to go away with mum and come back the following week and tell me about the knee joint. So when we were having a discussion maybe about what was going on, suddenly I had an athlete that was educated. I wasn't talking in a different language. I wasn't talking in medical jargon. I was talking in a way that actually she could understand. And what's quite important when you're working with an athlete is get them at the end of that session to reflect on what is wrong with them. If they had to go away and explain what was wrong with them to their friends, how would they do it? How would they explain to somebody what that I've just done with them, the treatment? So in that case, we want to create the educated expert patient and let them feel in control of that experience. I've used social modelling quite a lot, where I've been particularly putting youth athletes together, who are injured youth athletes together with more senior athletes of the same gender, of the same sport, and that works really, really well, and that's a powerful one. What I've done before is I've just connected those two individuals together, and I've taken a step back from that. That is done exclusive of me, and actually hope provides a really good support network. And I'm lucky I've got a number of different social models up my sleeve to do that. And also, I've mentioned before the use of social media, so they don't feel isolated, they don't feel alienated at a time where actually their time with the first team may well be non-existent or may well be restricted. And the social media with their friends, their teammates, but also the people on some of these more self-help Twitter handles may well enable more adaptive responses. And here are some kind of reflections that I got back in terms of the blogs. Just some really lovely data that was certainly posted to me. So this is quite important that we can understand an athlete and how rehab is impacting an athlete. So rehab's quite slow. I got frustrated with simple exercises that I thought I could do, but I couldn't, and the self-efficacy that hits. When I was able to exercise, I felt great inside, like they've accomplished something, proud. And I think we need to realise with athletes, psychologically what we're asking them to do frustrates them, but they find it difficult. They do find little things difficult, and that's a really important point. After week 1 of having him at the club, doing sport-specific rehab. And this was really important with an athlete that I was working, where we started saying, well, why are you doing rehabilitation without a ball? Have a ball at your feet. You are an athlete. Carry on as an athlete. Everything you do, have the ball there. And she talked about, it's a magic feeling. It's great. Nothing could stop me. A field note I made at the time was like having the ball at my feet was like having my best friend back. Really high impact reflections on that. And then next Thursday, again, because this person had been told exactly what to expect, what criteria they need to hit. Next Thursday, back in training, absolute buzzing, exactly what they wanted to hear. I think my injury will always be with me, which is a very interesting point and something that I think is a challenge we need to try to address. And being back's amazing for me.
Okay, so Dale's just been looking at some of the examples of injury response, and I'm going to talk through now some of the different examples related to rehabilitation. And one of the most common models in the literature is Brewer's biopsychosocial model of sports injury rehabilitation. And this is essentially ascribes to the biopsychosocial approach, which suggests that rehabilitation outcomes are often a consequence of quite a complex, quite a dynamic interaction between different biological, different psychological, and different social factors. So this is actually, it's a really useful model from an applied perspective. It's something that we've found is really useful for sports injury rehabilitation practitioners to consider when trying to take into account the range of different factors that can affect an athlete whilst they're injured. Now, one of the purported limitations in the literature is that it isn't assessable theory, and also another is that it doesn't necessarily provide explanations of the nature of the interactions between these different factors and the rehabilitation outcomes. But a key strength of this from a practical point of view for us is that appreciation of the biopsychosocial approach, and that appreciation that actually the biopsychosocial factors actually will be key to determining different sports injury rehabilitation outcomes. And when we're looking at different rehabilitation outcomes, we're talking about some of the different elements such as performance levels, different aspects of treatment satisfaction, readiness to return to play, readiness to return to training, and readiness to return to competition, depending on which particular context you're looking at it in. And also in terms of looking at rehabilitating the athlete as opposed to just the injury, different factors that can affect their overall quality of life as well. So from an applied perspective, it's a really important model for helping practitioners to almost to remind themselves of this myriad of different things to take into account. Now, in terms of fostering rehabilitation, examples from our practice, again, one of the key messages that we always like to give to athletes is actually focus on what is possible and focus on what you are able to do, rather than spending too much time on the impossible or what you're unable to do. And again, we had a very similar model to the approach to rehabilitation as we did with the responses to injury. So again, making use of either unstructured or semi-structured interviews, depending on which was appropriate with the athlete. And really that was to help us to understand kind of the rehabilitation beliefs, different factors that might be affecting rehabilitation adherence, rehabilitation compliance. And also, again, making use of kind of more objective outcome measures that can be quite useful for practitioners. So the two that we've used in practice quite extensively, the Sports Injury Rehabilitation Belief Scale and the Sports Injury Rehabilitation Adherence Scale, which just provide us with another opportunity to get feedback from athletes. Where do they think they are? How do they think they're going? What are the different factors that might be affecting them? And us being able to use that to triangulate that with our day-to-day conversations with athletes. Goal setting from a holistic perspective has actually been quite important. So working with athletes, again, not only just to look at, for example, being able to achieve a certain degree range of motion, for example, but helping them to consider where their rehabilitation fits in within their overall life. So for example, with elite senior athletes, where does their rehabilitation fit in with any external responsibilities that they might have? Where does it fit in with any family responsibilities they might have, that type of thing? And for some of the younger elite athletes, where does their rehabilitation fit in with things like their school life, their social life, those types of things that really are quite important for considering when you're working with the whole athlete. The goal setting kind of perspective is very much based on the SMARTS acronym, so goals that are very much action orientated and self-determined as well. So making sure that the athlete really has a say in what they're trying to achieve and really understands what they're trying to achieve, so they've got that degree of control over what they're doing. They feel more involved in the process, and really helping them to have that sense of autonomy throughout the process. And one of the key things that can really kind of affect athletes throughout the injury process is this notion of this loss of athletic identity that Dale alluded to earlier on. And some of the different strategies that we put in place there, looking at different training and match day roles and responsibilities. So one of those examples could be working with the coaching staff to monitor if we take a football example, to monitor a particular player from the opposition team to see different ways in which they are influencing the match and helping to provide that feedback to coaches and maybe to different players working. So they're really helping to maintain their involvement. In a rehabilitation setting, wherever possible, having their rehabilitation take part in either team. So rather than away in a clinical setting where they can't even see the teammates, let alone be anywhere near them and feel like they're working with them. And that then also, allows athletes to feel they're still in contact with the team, they're still in contact with the coaching staff. And there's a debate to be had about whether or not, this might frustrate the athlete, it might increase levels of anxiety, it might increase levels of anger, that type of thing. But actually, in our experience with the different types of athletes, it's actually been quite beneficial for those athletes in terms of still feeling part of the team. And this other notion, again, Dale alluded to earlier on, this notion of optimising trainability. So in the football context, as much work with the ball as can possibly be done, so the player still feels like a footballer rather than just an injured person. And then the last part to include with this is some of the psychological skills training, and very much the use of multimodal psychological skills training with athletes. So, looking at the use of imagery with athletes, looking at the use of muscular relaxation with athletes, predominantly. And taking into account how actually, there isn't a one-size-fits-all approach to this, and it's quite important to consider that actually athletes might have different preferences, and it's important to be able to work in different ways in a way that the athlete will buy into, because ultimately, if the athlete understands and appreciates the value of what they're doing in that way, they're more likely to buy into it, which ultimately is then going to have more positive rehabilitation outcomes for them. Now, we mentioned earlier on that one of the things that we were quite keen to do is try to help athletes to understand that actually injury isn't just a negative experience. And actually, some of the times we found that athletes actually see an injury, it's a little time for a little bit of a timeout. It's time to focus on themselves a little bit. And it gives them the opportunity to reflect on where they are as an athlete and where they are in their life outside sport. And it helps them to think about different ways of developing. And we've got this growth mindset diagram on here because it's actually something that's been quite central to some of the ways that we've worked with athletes when trying to help them to embrace the positive elements. And one of the things, which athletes quite like the notion of challenges and things that they can achieve by the nature of things. Quite often the athletes that we work with have been really quite competitive. So this embracing this challenge, this is again something that's there for them to achieve. And Dale mentioned earlier on the importance of athletes having a clear understanding about how their rehabilitation will work. It won't be linear. There will be setbacks along the way, and try to help athletes to understand what these setbacks are and different ways that then they can persist in the face of these different setbacks so as to help to further the benefits for their rehabilitation outcomes. Promoting the notion of hard work and effort and maintaining that throughout. And one of the important parts of the social modelling is actually helping athletes to learn lessons from people that have been successful in the same situation. So some of the different ways we've talked about the importance of using injury as a learning experience, and actually looking at the athlete education as an important element for the athlete to be able to maintain control over what they're doing. Helping using the injury period to foster coach-athlete relationships. So it's something that the coach and the athlete can still communicate about during the injury period, so it helps the athlete to maintain that sense of want and that sense of still feeling part of the team, as well as allowing the coach to see that the athlete is actually still working to be actively involved with the team as well. So all of these are different ways that we've worked to try to help different athletes to overcome adversity as part of their rehabilitation experiences. And we're going to look at some of these in a little bit more detail later on when I present a case study of an athlete that we've worked with.
Okay, so progressing on. How do we know an athlete is ready to return? And I figure one of the strong messages that I really want to send out, or we want to send out in this presentation, is that don't just base that purely on physical outcome measures. And then when we start talking about, okay, we need to include psychological or psychosocial outcome measures, well, what are these? One of my favourite papers at the moment is a very interesting read by Podlog and colleagues, 2015. That is one of few papers that have actually explored this phenomenon of readiness to return to sport from a psychological perspective. In a qualitative study, they certainly found that actually readiness to return, or psychological readiness, is affected by 3 different components or attributes. One was confidence, and when you see confidence as multidimensional within this context, so confidence in the injured body part, but also their confidence in being able to go back to sport and perform to a satisfactory standard. The second attribute was realistic expectations, and those realistic expectations were of their own capabilities. They recognised they weren't going to go back, they weren't going to play at their best, they weren't going to be as fit as everybody else. They may be a little bit rusty. And the third attribute was previous performance standards. And the motivation that's gained about trying to get back to those levels of performance. For me, that's quite a dangerous thing. Whether an athlete, we should be focusing on an athlete getting back to their previous performance and getting back to being the same, or actually getting back to sport and being slightly different. A new athlete is worthy of a bit of a discussion. In terms of our applied experience, how have we looked at whether an athlete is ready to return? Well, certainly the key for me is using a very robust return to train, return to competition-based criteria. My return to train criteria includes triangulation of decisions. So what I end up doing is the player signs, the coach signs, the parent when appropriate signs, and the medic signs. So actually this multidisciplinary sport team all agree this player is ready to return. The coach is happy, for example, with their training form when returning to training before they return to competition. Okay, and that's quite a useful triangulation to undertake. A return to competition and training criteria using biological, psychological and social outcome measures, and not just purely relying upon one inventories. Now, in the past, I've used the Glaser psychological readiness to return scale, and I've also used the Walker re-injury anxiety inventory. Some of those, if we think that athletes want to return to sport as soon as they can, are quite easy to gain a favourable response. So it's one way you must triangulate your responses. Triangulate your physical-based criteria with your psychosocial-based criteria to really get a good picture of where they are. They need the performance expectations managing. So that right from the start, athletes are made aware of the criteria they must fulfill before they return to training, before they return to competition, and use that almost to create the goals and tick them off throughout the process. And in terms of by the performance expectations, that make them sure that there is a process from returning to training through to competition, and actually they may only play part of a match. They may be substitute for the first few matches, and that actually they may well be rusty. They may not play that sport better than they've ever done. And actually saying to an athlete, you know what, you may not actually ever be exactly the same athlete, but may help manage some expectations. It may be not what the athlete needs to hear, but it will manage those expectations. They may find it tough. And for me, replaying the inciting incident is a real key to that, which is one, to reduce any sort of fear or anxiety over re-injury, getting them to replay over and over again the incident that caused it. In the case of an ACL, we've done a non-contact diagonal cut or a non-contact jump into a cut. just so they get that confidence, they reduce that anxiety. And according to the Podlog paper, hit the number that those attributes to know that they're ready to return.
Okay, so what we're going to talk over briefly now is a case study, and this is a case study of an elite female football player who had an anterior cruciate ligament reconstruction. And we're looking through kind of the rehabilitation journey here, so starting to look at how we work with this athlete right from the point of examining their responses to injury all the way through to return to competition, and looking at some of the reasons behind that. Okay, so Dale mentioned earlier, one of the things that we're quite keen to do with responses to injury is make use of appropriate objective inventories, and also make use of interviews. So in this instance, looking at using the ARIIQ and interviews with the athlete, but also one of the first things we did was do an assessment of social support. And one of the interesting things from this was the athlete kind of felt a little bit like didn't know who to talk to about this outside the kind of the sports science and sports medicine team. Knew that a lot of athletes got injured with this type of injury in this particular type of sport, but then wasn't really sure how to access them. So one of the first things was start looking at how we could provide the athlete with the opportunity to access social support. So there was that opportunity there for shared experiences and to support the athlete from that perspective. We also looked at the athlete in terms of educating them regarding the injury, and this was really important in terms of helping them to develop realistic expectations. Now, one of the key things behind that is this notion kind of uncertainty reduction. One of the things that we found that with athletes, particularly athletes with long-term injuries, that the uncertainty of the unknown is something that's quite scary. So helping an athlete to kind of plot out a timeline of or a rough timeline of what to expect, and then helping them to know how to work through that timeline in order to reach a full return to competition is actually quite useful. And within that, it helps the athlete to develop this sense of control, this sense of autonomy, and because of that, they knew what to expect to be able to do. So in doing so, it's kind of helping to satisfy their needs for competence as well, in so much as they weren't expecting to be able to do things that they shouldn't be able to do at that point of the rehabilitation. We've also discussed the importance of having physical rehabilitation near the team where possible, and also within that we integrated a multimodal psychological skills training. So with this particular athlete, we used performance imagery, and this particular athlete's preference was to do it from a first-person perspective because they found that they could elicit a much stronger image from that point, and they found that quite useful because it helped them to create a picture of what they wanted to be able to achieve, and the athlete then from that point actually developed their own imagery script based on where they want it to be, and they use that as kind of their guiding part of their guiding light through the process. But we also use some different relaxation activities, most predominantly progressive muscular relaxation with the athlete. Because one of the things that was quite important, particularly in their return to training, was that they're actually quite excited about this. It was something that they were really looking forward to, but also something they were quite tense about. So we use this as a way of trying to kind of help to manage any stress responses that might come along with that, try to manage any of the kind of the physiological sides of things like muscle tension. And we use that very much in an integrated way, so they were using these alongside their physical rehabilitation rather than it being, the psychological skills training being something that they would, for example, just do at home and then never address when they're at the training setting. The use of social modelling and social media, so actually helping the athlete to access more experienced players who have been through a similar type of injury experience so that they could share that experience, and so they could help to really understand what the future held a little bit. And social media was a really important part of it, and this particular athlete was really quite complimentary about the use of Twitter as a social support network. We used weekly plenary activities, and one of the most common ones was actually saying to the athlete, okay, and it's kind of from a pedagogical approach where we were trying to almost ensure that the athlete had learned about their rehabilitation and had learned about what the proposed benefits of it should be and how it was going to help them to return. So one of the plenary activities was actually, okay, now can you tell me how you would explain to your friends or to your family about what we've done today or what we've done this week and how it's actually beneficial for you, so that we could actually assess whether or not the athlete's being able to make that link. We've talked about the match day roles with the first team, and one of the key benefits of this particular athlete was that it actually helped to preserve a sense of worth within the team. They felt that they were doing something productive for the team to help work towards the team goals for that particular season, and they felt that they were helping their teammates and the coaching staff to try and achieve a desired result within a game as well. So it actually helped to really preserve that sense of athletic identity and help them to maintain that involvement with the team. We also facilitated player, coach and support staff updates regarding injury progress, and this was actually quite important, not only for the player but also for the coach and for us in a sense as well, because obviously a lot of what we do is guided by how the player is feeling at that particular time, and it's important for the coach to know that as well. And one of the kind of the important parts for us is that actually coaches are the body at the club which players will often find it most difficult to kind of disclose on an emotional level to. So us being able to facilitate that and being able to facilitate those updates was actually quite an important part. And again, it helped to reduce this sense of uncertainty moving forwards. And then when we're coming to the return to play, the return to training, the return to competition, again, using very much a multimodal approach. We talked about the use of interviews, looking at kind of observing how the player behaved in the setting, looking at factors, for example, their intent during different elements of the warm-up. Are they being guarded at all during different times? And if they are, trying to find out why that might be the case. Making use of the different objective measures, so the IPRRS, the RIAI, which, you know, really useful tools. They've been critiqued in the literature about maybe potentially being too unidimensional. For example, the IPRRS only really focusing specifically on confidence, and also there are some examples of professional practice where there may be some issues with socially desirable answers, particularly if athletes are aware that this is part of their return to competition criteria. But ultimately, in terms of what's available for use for athletes, quite beneficial in a professional practice setting. And then finally, our post-return to competition monitoring, so looking at how the athlete is managing that transition back into sport, looking at, you know, again, holding the kind of the feedback sessions with them, and just watching out for any kind of warning signs that they might be struggling with that return to competition.
And I guess the argument after that is, so what? What is the impact of this? You know, how does that benefit the athlete? And if we just look at things like treatment satisfaction in terms of quality of life as outcome measures, and we use these athlete reflections, these blogs to have a look at what really is going on, here's a slide which pretty much just says, I appreciate the support. I don't think I could be at this stage of rehabilitation without them. And that the athlete very much was grateful for the fact that we didn't just focus on physical rehab, but also the psychological side. Which kind of takes me to the final slide, which is, what do we still not know? Where are we as a research area? Because again, we're evidence-based practitioners. We want the research to stimulate and impact practice. So in terms of the extent of the association between psychosocial factors and outcomes of rehabilitation, we simply do not know. And by that I mean we don't know the extent that psychosocial factors are associated with outcomes beyond, for example, the biological and the physical factors. And I think maybe if we try to be a protagonist for further research, we need to try to maybe look at the two occurring within the same research project as opposed to happening independently, so we can make some sort of causal inference. This is a research area dominated by ACL, so we know a lot about severe traumatic injury requiring surgical intervention, but beyond that, I think our knowledge of other injuries that may be just as pervasive within society is limited. What happens, for example, with overuse injuries? What happens with injuries that have been managed conservatively or don't require surgery? Is the experience, are the psychosocial factors the same for those? We simply do not know that as much yet. Again, very much like it being the research being dominated by ACL and severe knee injury related research, it's dominated by a male dominant participant as well. We don't know a great deal about gender differences. We don't know a great deal about either the younger ages or the older ages. We certainly don't know about people across different performance levels or those with disabilities. That is an area, again, which is worthy of future research. The work of Costello, who published a great article on where are all the females in sport and exercise medicine, who starts looking at actually females are an underrepresented gender within this and may well display dimorphic and phenotypic differences to males in terms of their responses. I think that's a really important one. For a disabled athlete, who may not have particularly much use of one or more of their limbs. What's that experience of being injured? Is that the same? Is that comparable against an able-bodied participant? We don't know, for example, what constitutes a successful rehabilitation, or we do and it's too simplistic. We normally base it on time loss or have they returned to training or competition, but it's quite likely, as Wadey highlighted, that successful rehabilitation is affected by multiple factors, such as biopsychosocial, technical and tactical factors. And we may need to try to look at, well, what is a successful rehabilitation? What does that mean to an athlete? A little bit more. And then really use a multi-dimensional tool for making return to play or return to competition assessments. That we look at using physical and multiple psychosocial measures to get the best picture going forward to allow for a successful rehabilitation and an effective rehabilitation back into sport.
Okay, that brings us toward the end of the presentation now. What we're trying to do here really is just produce a blend of different academic and professional practice kind of focused resources to try to meet the needs of the varied audience that we've got today. So we've got a relatively extensive further reading list there for you, should that be of interest, and all of the web links in there we've tested and they all work. So we'll hand back over now to Graham with any questions.
Hi. Well, we've certainly got plenty of questions for you to go at. So we'll get straight into it. The first one from Cecilia Fantapi, who's in Italy, who asks, how can a psychologist provide support service to an injured athlete?
Okay, well, thank you for that question. I guess from my perspective, it's the role of the sports psychologist. I guess it really starts before the athlete gets injured and working as part of that multidisciplinary team or the interdisciplinary team to actually work to try and reduce the level of injury risk, or to work more from a preventative perspective. But if you're actually working from a point of view of you've got an injured athlete, then really again working as part of that interdisciplinary team is an important element. Being able to liaise with your sports therapists or your physiotherapists, the medical practitioners, but also with coaching staff and players, to be able to work towards that common approach. I think the sports psychologist will have probably a quite important part in contributing to the needs analysis produced with the athlete. If we are truly working towards this biopsychosocial approach, then it's really, there's an important element to that. And there may be a requirement, depending on the staff team and the people that are working as part of the team too. The sports psychologist may need to take the lead on maybe things like traditional psychological skills training, or if other aspects are needed, things like counselling approaches or motivational interviewing approaches, that type of thing. and it might be that the sports psychologist will be the one that would, that may need to take the lead on those elements. And again, I think the sports psychologist might also have a role, depending on the type of team, to work with other staff as well to help to develop their knowledge or their understanding or their appreciation of the importance of different psychosocial factors as part of the athlete's injury experiences.
Okay. Hello.
Hello.
Yeah, sorry, I just lost you for a moment there. Second question, to what extent does personality play a part in rehabilitating the athlete?
That's a question that I would probably feel much more confident asking or answering, had it been rephrased as injury risk. There's far more empirical work on how personality affects an athlete's risk of injury with the work of Madison and Ivarsen. But in terms of, I do think there's a link between the two. I think the link between the two is under-researched. There's sort of dated research out there and not much really that's come out above, I think, a 1979 paper by Wise, who talked about hypochondria and hysteria affecting rehabilitation outcomes. I think the question is it comparable to other factors affecting rehabilitation, for example, such as more physical or biological factors? I think if you were to kind of push me on what I think it's about, I think there are certain personality traits and that certain personality traits have a predisposition to use certain coping mechanisms. And it's those coping mechanisms which may in turn affect the intermediate or the sports injury rehab outcomes. So, for example, certain personality traits may be more likely to use less adaptive coping mechanisms or more adaptive coping mechanisms. So, for example, we're led to believe that more approach-focused or problem-focused coping mechanisms may lead to more positive rehabilitation outcomes, whereas avoidance coping strategies may have a negative effect on rehabilitation outcomes. Although a paper that springs to mind is the Carson and Pullman paper in 2010, who actually talks about the facilitative effect of avoidance coping, because actually removing themselves away from the team dynamic help them deal with some of those more intense emotions. So I think there is a link. I think it's probably mediated by coping, and I think there's a bit of research to be done.
Okay, next question from Matt Ty, who's at Southampton Solent University. How does a social network around an athlete affect their rehabilitation?
Ooh, okay, that's I'll address that one. So for me, the social support that an athlete has available to them is absolutely imperative to their rehabilitation. There are studies which suggest that athletes commonly feel alienated, feel isolated, and these are key psychosocial factors that will influence their decision to return to sport or not. I think this isolation and this alienation is still present upon their return to competition. They still don't feel quite with the team dynamic. I think we need to start asking questions of the athlete about their satisfaction with their social support. What are their social support needs? Because obviously there are various different forms of social support needs. Are they being met? We can intend to give a broad range of social support, but how do athletes actually perceive that? I talked in the presentation about using the social media as a 24/7 approach to social support. So the social support network around the athlete is really important, and as an injury practitioner myself, establishing what are the needs and how can we address those needs through forming a really robust rehabilitation alliance is absolutely key.
Okay, Jim Lowther wants to know, Jim Lowther is at Ulster University, he's a lecturer there. He wants to know how important is this topic for coaches?
Okay, well, thanks for the question, Jim. I think I'll take that one. As we said in the presentation, I think actually often it's most difficult for athletes to emotionally disclose information to coaches, depending on the coach-athlete relationship. So I guess from that point it's quite important. I think it's also important from the perspective that actually, you know, coaches can have a really important stress buffering role with athletes, but actually at times the coaches can sort of become a stressor themselves. And I think coaches appreciating that is a really, you know, is a really important factor. I think as practitioners, it's important for us to appreciate actually, you know, coaches and players, they have a need to be back in the game, if you like. And quite often there are a multitude of pressures both inside and outside the sport that, you know, that mean that there are kind of different stresses that are placed on an athlete. So I guess a lot of the answers that we'll give, sorry, kind of trying to appreciate that. But I think one of the other important things for coaches is that an appreciation of this area will help many coaches to move beyond the sense that actually it's just biological or sort of physical, physiological, biomechanical return to play or return to competition criteria that are important. You know, there's other factors that are in play here that could play a really important role. You know, we earlier on gave some examples of elite level athletes and their responses to injury, and you know, one of those actually had quite a supportive coach in their experience that was, you know, kind of take the time that you need, keep us updated with things, and that kind of facilitated that rehabilitation quite well. And I think the more that coaches know about this, the more that coaches can be actively and in a way proactively involved with the return to competition of athletes as well, and helping them to make informed decisions as part of really an interdisciplinary team that's working with the holistic best interest of the athlete at heart. That answers the question for them.
Okay, I would like to ask this next question, which is from Jody Maguire, who's in Australia, and I know he's logged on, and I don't know what time it is in Australia, but I really feel we ought to answer it, because she's been like the kid at the back of the class who's got the hand up all the time saying me, me, me. We've been peppered with questions from Jody, and it's only fair that we answer at least one of them.
That's great. I mean, I think this will probably be the time for one more question, Graham.
Okay, well, we'll make it Jody's in that case, because I think he's earned the right. Is there such a thing as a psychological rehab plan that sits alongside the injury management plan?
I'll answer that one. So, from a practitioner point of view, the injury management plan or the rehabilitation program varies so much from professional to professional, club to club, that there isn't really a consensus. When do we know someone is absolutely physically ready to get back into sport? We kind of know the broad concepts and the broad outcomes they need to be, but not that in terms of, shall I use one test, shall I use muscle strength more than I use range of motion, etc. So a psychological rehabilitation plan that runs alongside a really robust, more physical rehabilitation program sounds brilliant to me. It's something that we've tried to implement. We've got it partly right. I wouldn't say that we've got it perfect, but certainly recognizing that your return to play, your return to training and competition needs to be made up of both psychological and physical based outcome measures, and we are aware of maybe some of the reliability issues around some of these psychological based outcome measures, very much in the way we're very aware of the reliability, sensitivity and specificity of some of the physical based outcome measures. I think it's a great idea. I think I would encourage all listeners that work with injured athletes to sit back and go, well, okay, what outcome measures can I use to make sure my athletes are psychologically ready to return? I think Adam just wants to add a little bit onto that.
Yeah, thank you to Jody for, I don't know what time it is in Australia, but thank you for the staying up now. Just to add, really, I think one of the things that we're trying to communicate is there isn't such a thing as a one-size-fits-all approach when it comes to the psychological rehab as an athlete. You can have sound principles in place that involve, you know, the need for a sound needs analysis, the need for monitoring the athlete all the time, and that may include using appropriate inventories as well as linking those with observations and actually sitting down and talking to the athlete. and I think that there will be a benefit of having a multimodal program in there that incorporates perhaps elements of traditional psychological skills training, with kind of some of the more contemporary elements involving things like mindfulness, acceptance, commitment, and also making sure that there are professionals available that can, if they need to provide things like counselling support to athletes, that type of thing, that you've got that in hand. So as a principle for a rehab plan, I think that that's the model that we've kind of tried to use, this robust needs analysis, and it's individual specific based on their particular requirements. And I would probably say try to move away from a one-size-fits-all approach of, kind of, I'm going to go to that particular psychological school and do that all the time with everyone. If that helps to add to Dale's answer a little bit.
Fine. I would like to apologise because we've got probably 20 or more questions in the pipeline, but we'd love to answer. We've just run out of time, unfortunately. We will try and I'll forward all your questions to Adam and Dale, and hopefully they'll be able to answer them online for you by email. They are busy guys, so please be patient. I'd like to thank everyone for joining us today, and in particular, obviously, Dale and Adam, for what I'm sure you'll agree was a really fascinating and rooting performance. There will be an opportunity to complete a short survey at the end of today's webinar. We appreciate your feedback because we are continually trying to improve what we present to you.